Hi there. My name is Mendy Muir Busby. I wasn't sure how formal this would be, so here we go. Back in 2005, when I was 25 years old, I was officially diagnosed with type 2 diabetes. At that time, I was in denial. And for the next 10 years, I really felt ashamed. I actually felt embarrassed to have to tell people that I couldn't have the margarita, or I couldn't have the piece of cheesecake, or I couldn't have the brownie because it would just make my sugar spike. So I didn't. And I continued to live my life the way I probably shouldn't have. 10 years later, at the age of 36, I was diagnosed with metabolic syndrome, meaning that I had high cholesterol, high blood pressure, high triglycerides, insulin resistance, insulin sensitivity, and I was type 2 diabetic. Again, I was in denial. My doctor at that time said that if I didn't change my lifestyle, I would be on dialysis by the age of 50. I was currently at that time on 6 medications. I was taking metformin, 1,000 milligrams twice a day. I was on cholesterol medicine, blood pressure medicine, anxiety medicine, and I was again still in denial. Then my mother, who is also type 2 diabetic, but was very, very healthy and took very good care of her health, suddenly passed away from a stroke due to stress. I'm sure also because of her diabetes and because just of life. My father had Parkinson's and dementia, and I felt like it was my job to take care of him. So I put off taking care of myself even more. At the age of 46, finally, after the death of my father in October of 2024, I made the phone call to my coach, Sarah Jane Barno, asking for some snacks. I said, I can do it on my own. I'm doing low carb. I just need some snacks to fill the gaps of times when I can't eat a full meal. She said, well, it sounds like what you're doing is very similar to what our program offers. And let me share with you some of the fuelings that we offer to fulfill some of those other poor choice meals that you are making. At that time, my fasting sugar was 234. My A1C was at a 12. My triglycerides were at 174. All of my cholesterol was bad. My blood pressure was okay because I was on medication. So I started Optavia, and within the first 3 months, my A1C came down to 6.9. My fasting sugar was at a 96. My good cholesterol was at 160. And my triglycerides had gone down to a 94. Over the next couple of months, I check in with my doctor every 3 months. So over the next couple of months, my A1C now is at a 5. My fasting sugar is at an 86. My cholesterol is still very good at 155. And my triglycerides were at a 74. Optavia has really changed my life from the inside out. Also, thinking about visceral fat and the hard fat around your organs that don't allow us to have our body function the way that it should. I had fatty liver. In fact, probably I believe around the age of 40, I was diagnosed with a fatty liver on the road to cirrhosis of the liver because of the fat around my liver. My visceral fat, I'm not sure the starting point of my visceral fat, but my visceral fat came down to a 9. And as of yesterday, which was November 19th, or maybe even the 18th of 2025, my visceral fat is an 8. I did lose 52 pounds on Optavia. And since then, and since I've hit my goal weight, I've still lost 3% body fat and 3 pounds of muscle. I've gained 3 pounds of muscle because I am strength training. I also, along that line, I need to go back and give you a timeline, added a GLP-1. So I added a GLP-1 to its maximum dosage because, as I mentioned before, my diabetes was so severe, I do need it to maintain my blood sugar. But I am only on the GLP-1 now. I'm not on metformin anymore. I've also reduced my blood pressure medicines to 1 instead of having to take the amlodipine, which was a water pill. So I still am on my cholesterol medicine, and I'm still on my blood pressure medicine, in which I take half of a tablet now. And I'm still on my GLP-1. I'm still, of course, on my anxiety and depression medicine too. But I feel better. I feel the best I've ever felt in my entire life. And it is all because I truly believe, because of this program, because of the consistency, because of building in the healthy habits. And I truly, truly am the 3.0 story. And I truly, truly am changing my life from the inside out.